Now, this is literally affecting everyone. Now, the problem is, okay, have you ever wanted to throw a brick through your TV? Yes. Every time I hear, here, try this arthritis pain formula. Yes, take Advil and Motrin for peak performance. Well, that's insane. Let's look at what arthritis is. If you figure virtually every joint in your body is two bones coming together surrounded by a joint capsule, and that joint capsule is filled with a beautiful synovial fluid that lubricates and cushions them. And if you look at joints, the more mobile they are, the healthier they are. Remember when Mom said, don't crack your fingers? Well, I got to tell you, the British Medical Journal actually did a study on it and found out habitual knuckle cracklers actually had healthy joints. Whoa, think of that. So does that mean if your joints are mobile, they're healthy? Yes, because what does mobility of the joints do? It causes increased synovial fluid production, and joints can actually regenerate. That's right. Arthritis is not a death sentence. Arthritis is actually correctable and reversible. Just like if you cut your skin, it heals. If your joints have damage, as long as they move, you can regenerate cartilage. And this is going to scare people. You can regenerate meniscus. That means even the knee joints can regenerate. But what does that require? Remember, joints, two bones coming together, surrounded by a joint capsule. That means that joint capsule is filled with synovial fluid, which is a superfiltrated blood. So does that mean if you have toxic blood that's thick, that's unhealthy, maybe your diet is high in polyunsaturated fats like corn oil, canola, soy oil, that's going to make the blood thick and clump together and not be able to filter? What if you have a blood sugar issue, such as a misdiagnosis of diabetes? And that means that that blood is not going to be healthy and won't be able to get into the joints. So how do you fix arthritis? And no, it's not genetic. Don't be afraid of your genetic coding. Okay, there's a difference between genetic and genetic expression. So when you look at this, healthy blood is going to equate to healthy joints. Healthy joint movement is going to equate to healthy joints. But also look at the surrounding structures. Those surrounding structures are vital. You're never going to fix a knee issue unless you take care of the biomechanics of the foot, the biomechanics of the calf, the biomechanics of the low back, and of the pelvis. All of those are involved in healthy knee function. When you look at healthy foot function, all the nerves that come out of the low back that supply the foot, if your foot starts to flatten out, that means plantar fasciitis. We're talking bunion formation, flattening of the feet. All of those have to do with the nerves that supply the arch of the foot. So when you're talking about every arthritic change, and I mean of the shoulder, of the elbow, of the hand, of the hip, of the knee, of the feet, every joint in the body can be helped if you have healthy blood supply, healthy nerve supply, and healthy movement. Realize that when we reverse arthritis, we cause an inflammatory response at the joint to regenerate. Did I just say inflammation helps? Yes! Inflammation is a repair process of the body. You ever scratch yourself? What it is? That's red, that's inflamed, that's how the body heals. So if you do a local inflammatory response at that joint in an appropriate direction with an appropriate force load, you're going to actually regenerate that joint as long as you have healthy blood supply and healthy nerve supply. Take charge of your health. Do not drug symptoms, because if you've ever heard of non-steroidal anti-inflammatories like Advil, Motrin, Aleve, ibuprofen, all those other ones, okay, those inhibit proteoglycan production. That's the building block of cartilage. Think of how crazy this is. You've got doctors prescribing a drug for joint problems that destroys joint cartilage. The doctor's doing that. Fire that doctor. Hire someone that realizes that joints can regenerate. Now click on the link where we go into our 45-minute talk on how to regenerate joints. And also check out our foot health video, our knee health video, our pelvic health video, our cervical spine health video, our lumbar health video, our thoracic spine video. Every video that we talk about regenerating the body and reversing arthritis. See you there.